Okay, we will next walk through various organs in the body that produce hormones. We'll hit about probably four or five of them, and your job is to know what hormones are produced and what the effects of the hormones are once they are released into the blood. So let's begin with your pineal gland. So again, the pineal gland was discussed before somewhere. This gland makes a hormone called melatonin. This hormone is critical in setting your circadian rhythm. Okay. It's also believed to be involved in setting puberty, the timing of puberty. Its level, it tends to spike. So when you're sleeping in the dark, levels of melatonin go up. So it spikes in the dark. In winter months, it also spikes. And it causes what's something called seasonal affective disorder due to elevated levels of melatonin. Okay, and these higher levels can cause, irritability. I don't know what's going here. Make it irritable. Irritability, as well as depression. It's normally treated by what's called phototherapy. Put you in a room, turn the lights on to lower down the levels of melatonin. That way you're not off your rhythm, so to speak. Then we have the thymus gland. This gland sits right here. Okay, well, I have down here. Up here is the thyroid gland. Down here, the thymus gland in between your lungs, or around the area of your esophagus. So here, the thymus gland typically is most useful during childhood. Here, it makes around 3 hormones called thymulin, thymosin, and thymopoietin. All 3 hormones, their job is to mature your lymphocytes. Mature, especially your T cells, called T lymphocytes, critical cells in your immune system. It also helps to develop your lymphatic tissue. Like things like your lymph nodes, for example, are helped in the development and maturation by the presence of these hormones, which are made by the thymus gland. Okay. Another gland of interest to us will be, let's try this one. This one's fancy board here. Okay. Let's try your thyroid gland. So your thyroid gland, which is right here. Okay, that gland has in it these structures called thyroid follicles. Thyroid follicles. And in the thyroid follicles, we have these cells in the walls of the follicles called follicular cells. So these are your follicular cells of the thyroid follicle. You also have cells sometimes in between the follicles. These cells we call your parafollicular cells. And these 2 cell populations produce different hormones. So let's first begin with your follicular cells. Your follicular cells make thyroid hormone. Okay? And thyroid hormone is made when iodide is absorbed by your follicular cells and then pushed into the center of the follicle, where they're complexed into 3s or 4s that we call T3 and T4. That's what these cells are. They complex the iodine into 3s or 4 combinations called T3, T4. And so T3 stands for triiodothyronine, and T4 stands for tetraiodothyronine. And both of these are together called thyroid hormone. Okay, both T3 and T4. Now, so these cells will make TH and they will be released in response to TSH. So they're released into the blood in response to TSH. And when they release mostly, 98% of it is released as T4, 2% as T3, and then in the tissue, once they're absorbed by the cells, they are all converted more or less to T3. So T3 is the active form once it gets to the target cells. Now, the effect of thyroid hormone are, quite a few effects here. So we can begin with the effects, including they can increase your levels of carb absorption from the small intestine into your blood. Thyroid hormone also tends to, again, increase the expression of your adrenergic receptors, which in turn causes epinephrine to have a big effect. And it's this effect of epinephrine due to the permissive effect of TH that leads to your heart rate increase. So people who tend to have high TH hormones in the blood have what's called a racing heart due to epinephrine being permitted to have a bigger than normal effect on the heart rate. Okay. It also triggers the release of growth hormone, right? This is why growth hormone, endocrine hormone, suppresses TSH, so you can suppress TH at the same time. And also critical in brain development. Low levels of TH is usually linked with brain, malformation, underdevelopment of the brain. So that's TH, made by your follicular cells. Your other cells, your parafollicular cells, so go here now, the parafollicular cells, they make a hormone called calcitonin. Calcitonin. And that hormone is involved in decreasing levels of calcium in the blood, which means that it will trigger your osteoblast to absorb it out of the blood and use it to make your bones instead. So indirectly, it also drives for bone formation. Okay, that's the parafollicular cells. Now, still related to the thyroid gland, you have, in the back of the thyroid gland, you have 4 nodules called your parathyroid gland. And so these parathyroid glands, let's continue for a second. Your parathyroid gland, which are 4 nodules in the back of the thyroid gland, they make a hormone called parathyroid hormone. And this hormone has a job acts oppositely to calcitonin. Its job is to increase levels of calcium in the blood. Okay, and in so doing, it promotes you to reabsorb your bones. So it promotes bone reabsorption. Basically, it gets rid of your bones in some way. So bone reabsorption. That's its job. Okay, let's pause here.